Project Men was created to address the medical equipment needs of low-income people with disabilities. Our organization's founder was confined to a power chair and volunteered at the Texas Department of Human Services. It was there that he noticed social workers constantly trying to find medical equipment for their indigent patients. He knew there was a wealth of discarded medical equipment in the community, and this is how the concept was born of reusing medical equipment to help those that don't have the means to obtain it on their own. We improve the client's quality of life because they've been provided with the equipment needed to increase mobility, self-sufficiency, and personal comfort. To do this, we ensure that donated medical equipment is refurbished, sanitized, repaired, and put into the hands of those that need it the most. On a broader scope, we're expanding our capacity for storing donated medical equipment through either the renovation of our current warehouse and/or moving into a much larger warehouse facility. The more equipment we have, the more people we can help. Project Mend is the oldest, most extensive, and comprehensive durable medical equipment reuse agency in Texas. Since 1993, we've distributed nearly $5 million of medical equipment to those in need. Because of this track record, we've become a subject matter expert utilized at the local, state, and national level on medical equipment reuse. Through the years, we've built a large network of partner agencies that provide us with additional resources to help in assisting our clients. This network is invaluable and gives us credibility among the medical community. As a medical equipment reuse agency licensed by the Texas Health Department, we've established solid practices for receiving, evaluating, sanitizing, repairing, and putting into inventory donated medical equipment for distribution to clients. The reuse of medical equipment has a number of benefits, including saving equipment from dump sites, keeping unsanitary and potentially biohazardous equipment contained and out of the hands of untrained individuals, promoting a green-friendly environment, and providing a cost savings to the community. Reuse serves the uninsured, underinsured, and people experiencing delays in device acquisition, people who might not otherwise have access to the medical equipment needed for work, education, and other activities of daily living. Indicators of success for the medical equipment program are the number of clients we serve and the amount of durable medical equipment items that we're able to distribute. Additionally, we track the increase in the cost savings to the community measured by the value of medical equipment issued to clients each year. People often have the misconception that our medical equipment is reimbursed by Medicare. Because we are a nonprofit agency that refurbishes donated medical equipment, we are not a qualified vendor through Medicare. Another misconception is that we have the capacity to pick up and deliver medical equipment anywhere in Texas. Our small staff limits us currently to picking up donations of medical equipment as well as delivering medical equipment to clients within Bexar County only. Project Mend is a nationally recognized expert in medical equipment reuse and part of the Pass It On Center in Atlanta, Georgia, the National Assistive Technology Reuse Center. I serve on the National Task Force, and Project Mend's systems for client services, inventory tracking, and outreach arrangements are models for reuse programs across the country. Because of our experience, Project Mend is well suited to support and assist families with medical equipment and assistive technology needs that are beyond their medical coverage and financial means. Getting medical equipment to people outside of Bexar County continues to be a challenge for us due to our small staff. However, we are able to serve anyone in Texas through the client's family or friends that live in and around the Bexar County area. Adequate warehouse space is also a current challenge in that we receive so many donations of medical equipment, we are at a maximum capacity to store it at our current location. Additional resources would be utilized to help us reach our key goals that include finding a much bigger warehouse facility, develop a state-of-the-art location in San Antonio, increase and diversify our funding resources, expand our services to include mobile case management services, expand our organizational structure to create stronger leaders and more operational staff with expertise, increase and strengthen our relationships with donors and clients, and increase our medical equipment resources and partnerships. Transportation is always an issue for our clientele. We are currently working on securing an agreement with transportation companies to issue free transportation vouchers to our clients for doctors and Project Mend appointments. This is a slow work in progress. Another gap to fill would be the requests we often get from our clients for diabetic supplies, such as testing strips and glucometers.